Good morning all. Today the presentation is on a retrospective study of incidence of ocular trauma in tertiary care teaching hospital, South Kerala, India. So the purpose of the study is that etiology of ocular trauma differ in rural area compared to urban area, and it also differs in demographic or socio-economic classes. Ocular trauma is one of the neglected areas in ophthalmology which causes severe vision loss in the clinical setup. So the study was conducted to assess the different types of ocular injuries involving anterior and posterior segment of eye presented at emergency department and ophthalmology outpatient department of a tertiary care hospital. So the materials and methods, it was a hospital-based retrospective study which was conducted in Emergency Medicine and Ophthalmology Department of Pushpagiri Institute of Medical Science and Research Center, Tiruvalla, Kerala. It was done for a period of 2 years spanning from May 2021 to May 2023. Study populations were the patients with ocular injuries attending Emergency Medicine and Ophthalmology Department. Total sample size was around 487 patients. The inclusion criteria was patients with ocular injuries reporting to the emergency department and ophthalmology OPD who were aged between 5 and 80 years. Only ocular trauma less than 7 days of injury were included. Exclusion criteria were the old trauma cases. Data collection tools and techniques. On arrival to ED or OPD, the patient's age, gender, religion, caste, residential area, occupation, education were taken. Mechanism of injury including blunt or penetrating, velocity of the object. Then specific history including the date, time, place, whether it is RTA, circumstance of injury, characteristic of trauma agents, mode of injury were noted. Symptoms and signs, treatment or intervention already given, and the level of consciousness was noted. Then visual status before the injury were asked, that history was asked. Then basic examination including the visual acuity, slit lamp examination, intraocular pressure, dilated fundus examination, B scan, OCT macula and CT scan orbit if needed were taken. Following measures were taken during the eye examination precautions, that is use of eye shield to protect the eye. Then administration of systemic analgesics, tetanus toxoids or systemic antibiotics if needed. So coming to the results, in age-wise distribution, that about 38% of the patients were belonging to the category of 20 to 40 years, followed by 60 to 80 years, which constitute 16%. And sex-wise distribution, the more patients were males, that is around 62%. Coming to the mode of injury, in that the metallic foreign body caused the most, in most cases, injury was caused due to metallic foreign bodies, that constitutes 51%. Followed by wooden road traffic accident 21%. Then complications, most of the complications were caused due to the superficial metallic foreign body that causes injury to the cornea. Then total 487 patients participated in the study. 62% were males and 37% female patients. Most vulnerable age group was 20 to 40 years, and around 24%, 84% had unilateral involvement, and maximum number of patients were industrial workers followed by farmers. And the most common mode of injury was the metallic injury, that constitute 51%, and non-metallic injury by wood was 15%, and road traffic accident was 9%. And ocular trauma related complications were mostly due to the corneal superficial foreign bodies, which constitutes 51%. Then coming to the data analysis that was done by IBM SPSS statistics, and conclusion is that ocular trauma is one of the major worldwide cause of preventable morbidity and accounts for 500,000 cases of monocular blindness worldwide, and corneal injuries were the most common injury that was noted in our hospital, and the males were most commonly affected, that is mainly due to their job types or eye injury still remains a significant cause of vision loss, especially in the younger individuals, that is most patients were between 20 to 40 years. So we have to make a current emphasis on the safe work environment must be expanded, and we have to adopt a protective precautions has to be taken, that is eyewear in workplace is crucial for preventing the eye injuries, and prompt medical attention can help to identify the severity of injury and reduce the risk of complications. So these were the references. Thank you.
Cracker injuries and all during Diwali times and all, we get cracker injuries.
Sir,
Are they included here?
cracker injuries were also came. Few injuries were there, but that the incidence was very low. That only 4 or 5 cases were noted.